Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Drs. Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Good evening and welcome to another Fuller Butz episode and podcast. I'm one of your hosts, Dr. Sam Fuller, revved up and energized. With me as always, Dr. Dan Butz. Dan, are you ready and excited for a very common topic?
I don't know if I'm as ready as you are. You must have like a Celsius or something.
Those are trendy. Those are non-alcoholic energy drinks. Is that right?
Yeah. It's like a lot of nothing natural. It's all artificial.
Okay. Yeah. Because I saw like two of my medical assistants drinking that in the office, and I was just hoping to God it was not alcoholic.
You kind of look like the tall boy.
I was like, what are you doing? You can't have a high noon it's right. Noon. So we have a great topic, an extremely common one that we get asked about, discussed a lot, consulted for, which is the difference between a breast lift and a breast augmentation. What's the right choice for each patient? And so we really wanted to debunk, demystify, try to add some facts and prepare patients who have upcoming appointments in Milwaukee with Dan or in South Bend with me so that they can be educated, refreshed, and we're really just reiterating some fine points. So Dan, for our listeners, can you briefly just summarize like what is a breast lift and what is a breast augmentation? What are those terms?
Yeah, so breast lift is kind of what it sounds like, is lifting. Really what we're doing is kind of tightening and reshaping the breast. So I would tell patients that we're leaving your breast tissue alone, but kind of removing a lot of the loose skin around it and repositioning the nipple up higher. The nipple is not removed. It stays attached to the breast tissue. So sensation is, the vast period of time intact as well, but all about shape and position. So things aren't drooping anymore. Some people just genetically have droopy breasts. Sometimes it's after breastfeeding. You lose volume and things sag, or weight loss. Breast augmentation is augmenting the breast or enhancing the size, typically using implants to give more volume. Is that a brief enough summary for you?
Yeah. And so, we separated breast lift and breast augmentation. Is it possible to have both of those procedures done together?
Absolutely. It's very common. Again, this is, either weight loss, again, sometimes anatomy, or after pregnancy, you lose volume, you want to restore that, and then your skin gets loose. So just putting an implant in, you still have that loose skin on top of the volume. So then the lift kind of helps reshape things. So I probably do more augpexies than I do just straight implants, to be honest. And I think it's a very common question. Patients come in, it's like, I don't know if I need an implant or I don't need a lift. And a lot of it comes down to what their goals are. How do you talk to patients about, choosing what's right for them?
Yeah, so I actually stole one of the questions that you ask, which is about being in a sports bra. So I essentially just asked the patient, like, are you happy with the size of your breasts? Do you just wish that they were more on your chest and less closer to your belly button? And if you are, working out wearing a sports bra, do you feel like you fill out your top? Like, would that be sufficient? And if the patients are, want something that's very subtle, talk about ballerina bodies, just say, hey, no, I don't want to be bigger. I just want my tissues to be tighter. I don't want the skin rubbing. I don't want the droopiness. Then a lift can be a very good choice for them. If they say, no, it's still, I want that cleavage line back. I want, my breast tissue up here. Then I really say that a breast lift doesn't defy gravity. It's really hard to achieve the upper pole fullness, and that an implant, which does not have to look overdone or fake, something that can be extremely natural, may be the best choice. And you're right. I think I do more augpexies, which is augmentation and mastopexy, breast lift with augmentation, than I do either of the other two, because usually the patients that are coming in require both. Dan, what are some indications, or what would be an exam finding or something that would indicate that the patient would be a good candidate for either an augmentation with a lift or augmentation or lift alone?
Yeah, so a lot of it comes down to nipple position. And so we have different grades or grading system that we use, and the nipple position ideally is kind of in the center of the breast above the fold. When it starts to droop down is kind of when you start getting to grade 1 is kind of, just above. Grade 2 is at the fold, and grade 3, grade 2 is below. Grade 3 is pointing, like the nipple's completely pointing down. So, during the exam, we kind of obviously take a look at all these different things, take all these measurements. The ideal nipple position from your sternal notch to the nipple is anywhere between, maybe 17 for someone shorter up to 21, 22. Again, a lot depends on height. When it starts getting beyond that, this typically, lift's going to be beneficial. I've seen some people talk about kind of a pencil test, paper test. I don't know if that's really as beneficial. So that's kind of the general indicators where that nipple is positioned. And it basically comes down to that skin laxity and lack of volume. There's some patients, if you're kind of a grade 1 or just a little bit of laxity, an implant can fill and avoid the need for lift. I talk to patients about these kind of in-betweens where you could do a little lift and tighten it up, but you'd probably get a very, very good result without it. I often, what do you tell patients where they're like, oh, I really don't want an implant, but someone told me I had to get an implant? Do you think certain people need implants, or do you think it's really very optional?
It's totally based on each unique situation for a patient and what their goals and expectations are. If a patient says, I want cleavage, I want upper pole fullness, it's really hard to achieve that with just a lift or with just fat grafting, which we'll talk about in a little bit. And so if they are lacking volume, if they've lost a considerable amount of weight, if they've breastfed, they've had multiple children, and they're really losing, don't have that upper pole fullness, and they want that, then I would say that an implant would be the way to avoid disappointment, dissatisfaction, and to reach the goals that you need to. I'm always very open about the numbers and the math. I feel like it's less mystifying and less confusing. So as I'm measuring them, I'm saying, ideally, a sternal notch to nipple distance is no longer than 20, 21 centimeters. And so when I say it's 26 centimeters, 28 centimeters, I say that's consistent with us discussing that you would need a lift, either with your augmentation or not. And I'll also visualize and tell them that once we put the implants in, the implant's sitting high, but the breast tissue is still waterfalled over the implant, or some people call it a Snoopy boob. So if we're leaving that still behind, it's not necessarily going to perk up and pull back up. That's where a lift is needed to, almost like a tripod, reposition the breast tissue over the center point of the breast. At one of our meetings, there was a trick that another plastic surgeon mentioned as far as having them lift their arms all the way up and then putting their arms all the way down as a means to what an implant potentially can do as far as lifting the nipple. And if it still doesn't lift the nipple to that center point, that helps to confirm that a lift would be needed, as opposed to just a primary augmentation only without any reduction in the skin.
So you mentioned, getting natural results with implants. I feel a lot of patients come in and they're like, oh, I don't want big fake looking, breasts. I don't want implants. But like you're alluding to, these newer implants, there's a lot of different profile shapes, low plus. You can get these really, supernatural looking results with implants. Do you see that as well with patients? I'm worried about looking too big.
I think more than ever, the trend is natural. Just a refresh, sort of want to look like you have a push-up bra without it being obnoxious. And I think those trends are only going to increase. And really, that's what's available. I talk about patients and like what was on TV, nip tuck and things in the 90s, the 2000s, where it seems like you were just shoving in everything super big and everything was fake. Like it was had a bad rap. And now I think it's reassuring to tell patients that it can be very natural, and to tell them all the different sizes from low plus, moderate, mod plus, all the way up to the high and full profiles, that there's something for everybody. And just going again back to the math, measure their base width, and I bring out my book and say, hey, as long as we're sticking to your anatomy, to your to where your dimensions are, it can be a beautiful result. It can be very natural. Whenever we're trying to put something in that's too small, it's not going to fill things out. And whenever we're trying to expand or put an implant in that's wider than what you are, that's where you get the regret, where you're wearing multiple bras, you're feeling top heavy, or feeling self-conscious. And so, knock on wood, that's something that we avoid simply by following the numbers for that. When we're talking about breast augmentation and breast lifts, a common question that we both get is patients who want to be ultra natural by only using fat and saying, just a fat only or a fat transfer, fat grafting. Can you speak to a little bit of what, maybe a good patient would be, and what are the limitations of the fat transfer, how you use it in your practice?
Yeah. So when I talk about fat transfer, I really is just say there's a lot more variables at hand. How much fat we can get safely, how much fat we can put in, and how much sticks around. So if someone wants to have abdominal liposuction to improve that contour, they're going to be a better candidate right away, because then you get kind of a 2-for-1. You're going to get that, that added benefit of the liposuction. A lot of times, other patients are, BMI is less than 20 and they just don't have a lot of fat. We don't want to cause contour anomalies by kind of being too aggressive to get fat out. If you have smaller breasts, there's less kind of place to put the fat as well. So there's a limit to how much you can put in. Typically, we say you can maybe expect about 50 to 70% to stick around, although this newer device is maybe getting up to 80. So I tell most patients, conservative estimate, maybe you get a half cup size. So a little boost. And again, sometimes that's great and they're really happy with that. But with implants, when you can pick exactly what you want, you're going to get it. It's a little bit more reliable. But again, there are long-term implications we'll kind of touch on in a minute as well. But it is a really nice option for some patients, for sure.
Do you routinely fat transfer in your augpexy or your implant and augmentation cases, or is it not used maybe as much as other surgeons seem to use it?
Not routinely. It's very kind of sparingly if someone, they're doing the lipo, or, and they're really thin and need to kind of, camouflage things, or vision where they have something they're trying to hide. But I don't think it's necessary for the vast majority of augmentations.
And can you tell us what differences or similarities are for the recovery, the post-op care for a patient who's having a lift and a patient who's having a breast augmentation? Do you treat them any differently?
Yes. I mean, just a lift's a little easier because typically we're just tightening the skin and reshaping things. So we're not messing with the muscle at all. There's kind of less of a pocket that's created. So normally, similar general guidelines, 2 weeks avoiding heavy lifting, 4 to 6 weeks, kind of taking it pretty easy, but doing most of your regular stuff. With implants, we want to make sure that pocket the implant in is kind of very stable before you start pushing it too much. It's the same general guidelines, but a little bit more limitations on chest exercises and things like that. But neither of them, it's not an implant. If you're just doing an augmentation versus an augpexy, pretty much exactly the same. A lot of patients are worried the lift part of the augmentation is going to make it a lot worse. I don't really see that much. But just a lift tends to be kind of one of the easier things I think we do. Again, not aug lifts or implants with lifts are not that bad compared to, let's say, tummy tucks, but still relatively it's a little bit more, just limitations to make sure we're not pushing that implant around too much. What about you? Do you agree with that, or?
Yeah, I think it depends on the size of the lift. For a small lift, it can be a very quick recovery, very little to no pain. And as long as the skin heals, it can get you back up to full speed. Probably a few weeks faster recovery than an augmentation. If it's a sizable lift and there's, incisions that need to heal, then I'll still have them, invest in the recovery, as we've talked about in other episodes. But yeah, lifting the muscle up tends to incite a little bit more bruising and swelling. For doing an implant that's underneath the muscle, which is my traditional technique, I do incorporate an internal bra for the augmentations and the augpexies traditionally, not always for the breast lifts.
Does that change the recovery at all? People always ask me that.
No, it doesn't. It doesn't allow them to never wear a bra again, and it doesn't really change the recovery. And then it's still, time for things to settle out, to heal. And I also, it's dependent on their breast tissue. For really thin breast tissue, the lift is going to look a bit different than somebody who has dense, heavy breast tissue, where you can almost do an augmentation, where you are manipulating and moving tissue that might hold its ground a little bit more against gravity. But ultimately, gravity wins out. So do you want to speak about the maintenance of the two procedures? Like what, do implants really need to be changed every 10 years? Do you want to debunk some myths and tell us, maybe for
Yeah.
someone who's getting an augmentation versus a lift, what future procedures or things they should be on the lookout for?
Yeah, so a lot of times when patients are kind of debating, implant versus no implant, one of the main benefits of not having an implant is really there is no true maintenance. Granted, the results change over time. Your breasts are going to change. Everything changes as we age. They never tend to get back to where they started, but they're not going to be as high, tight, and perky as they were, 1 year versus 5 or 10. Implants, have more kind of required revisions. Not every 10 years. It's more probably average is more like probably 15 to 20. These newer implants, your rupture rates are much lower than they used to be. But at some point, you'll likely need revision. I think that's an important thing I tell everyone. They're not meant to be a lifelong device. And again, I think a lot of the revisions we're doing at, let's say, 15 years are to kind of maintain normal age changes. And the implants are often just fine and stable. Maybe the pockets are stretched a little bit, but that, like you mentioned before, that waterfall kind of drooping effect, 10, 15 years go by, your skin gets looser, you lose more breast volume, things sag off the implant a little bit. So sometimes a bigger implant can fix it, or a lift, or your goals might have changed. You want a smaller implant. So I think that's what drives most revisions, not problematic implants. But certainly it's important to kind of keep those things in mind when you're making that decision.
Yeah, where the adversary is gravity and time, ultimately that wins out. I have a few cases coming up where, a patient's gained weight from her primary augmentation from 15, 20 years ago, and so now wants to downsize the implant and get a lift and a refresh. And so it almost makes sense. They want a touch up that's there. Some patients are very happy. Their implants really have withstood the test of time, and that swap out can be a 30, 45-minute procedure where you're in and out and back on to the road to recovery within a couple of weeks. And so there's always some maintenance, but as far as some rapid fire questions that maybe we can rattle off to answer some other frequently asked questions. Do implants affect breast cancer or mammogram screening, Dan?
No, there's no increased risk of breast cancer. And there's some studies saying that you actually get diagnosed a little bit earlier in smaller stages, maybe because you're a little bit more, I think, breast aware and can feel things better on top of the implant. They do mammograms a little bit differently. They take an extra view and they try to displace the implant as much as they can. So they're able to surveil things just fine. Traditionally, it's easier to do mammograms if the implants are below the muscle than above. But I think with newer ultrasound technology they're incorporating quite frequently, it's not as big of a deal as it used to be. But certainly the big thing is just surveillance. So doing your self exams, seeing if things are changing, and doing the mammograms as recommended. Do you want to talk a little bit about scars? What's the different types of scars? Just an implant, lift, bigger lift?
Yeah, so traditionally, a breast augmentation, I think in both of our practices, we use what's called an inframammary fold, which is a incision, which is a very small incision that's in the fold underneath the breast, very well hidden. We can use the mathematical formulas to try to allow that to sit right where that crease is, so that it's very imperceptible. There's no such thing as scarless healing, but we can make it into a very hidden spot that can be just a few centimeters, typically 3-4 centimeters. Sometimes with the new Motiva implants, I feel like I need to lengthen the incision a little bit just to get the implant in, and that's just some of the nuances between the implants, but it's very marginal. That's closed with dissolvable stitches. Again, no drains. For a breast lift, that typically means that there's an incision around the nipple. That can be quite convenient to downsize the nipple-areolar complex. It's also a visual illusion, so there's typically different pigmentations to the skin that's there. So I make the ideal nipple-areolar complex size somewhere between 38 to 42 millimeters. We have sizers for that to downsize that. Dissolvable stitches around the nipple, a vertical incision that's connecting from the nipple down to where the implant was placed or where the inframammary fold is, to again tripod and pull that tissue up in order to regain that three-dimensional teardrop shape to the breast. Dissolvable stitches, scars are dependent on genetics, on individual treatment, on healing, reactions to adhesives and tape and scar care afterwards. And so scars can mature for 1 to 2 years, but they all tend to be very well tolerated. And in general, patients would largely sacrifice having a very fine, faint scar for the rejuvenation that they receive from their breast procedures. Dan, what tips do you give patients who are coming in for a consult for breast lift or breast aug? Like, how should they prepare? What should they bring with them? Do you have anything that would allow your patients that you really want to show up 5 minutes ahead of schedule, not sit down in your waiting room and just come right in? What should they be prepared to ask you or to share?
I think bringing in wish pictures to kind of help me visualize what they're looking for, thinking about what they're looking for in terms of sizes, and just kind of having understanding what their goals are. And obviously, a lot of the consultation is trying to understand what they're not happy about. A lot of times patients will say, "Oh, what implant should I do?" I'm like, "Well, you can have a great result with any number of implants, is because they're going to be very different. So whether it's 200 or 400 could both be very good outcomes, but I'm trying to figure out what the right choice is for you to get your goals." And then using, during the exam, allowing them to see it, I do kind of pinch test so they can see what just a lift might provide versus, then adding volume with sizing and the chrysalic simulation. But I think, again, being prepared for the consult in terms of, again, wish pictures can be helpful. But a lot of times I'm just like, these patients look nothing like you. So there's a lot of limitations of those as well. But it is helpful to get a little sense. And then just kind of having their, health history, if there is any. A lot of these patients are very young and healthy, but being aware of kind of anything that might make them not a great surgical candidate. But fortunately, those things are quite rare.
I agree. The wish pics, I always preface by saying, there's some patients may be 5'8" and you're 5'2". Some patients who's the same height and weight just may be, distributed that differently than you do. It might be more in their arms and legs. But I do feel like those pictures, even from my own website, and I do share some of the galleries that the before and afters, I do think it helps paint a picture of how subtle or how projected they want their breast to be. Because if they're showing someone who it barely looks like they have implants, it's going to tell me like, okay, they want something that's very natural, very athletic, that on that range. And if someone's showing me somebody who's like an adult film star, I'm going to be, kind of discussing that with them as far as some of the issues and, the realistic expectations that come with sizing a proportionate and appropriate sized implant. There are always some asterisks with that, but I would say as much information as you can get. I typically see patients more than one time before surgery so that we can really hone down on the perfect size and the perfect goals that they have. When you do a breast lift, Dan, is the breast getting smaller? Are you giving them a smaller breast?
I think we debated this last time. Typically I tell patients, again, I'm not, unless there's asymmetry, I'm leaving all the breast tissue alone and just really tightening it up. So it does fit into bras differently. And historically, we often tell them they can maybe go down a half cup size. But, if you measure that skin, it's, 20, 30 grams typically, which isn't all that substantial. But it's all about, I think it just fits into their old bras differently. Do you still think they go a lot smaller? You are removing stuff. You are right with that. I think that was
it's weight wise, they're not going to be much, but I think visually, if you have something that's very saggy, droopy, lengthy, and you are tightening up and pulling it up and making it firmer, kind of more stuck onto the chest, I think it could be perceived or seen as slightly smaller. It's certainly not bigger because we're reducing some of that. But no, it's not drastic. And that's why it's a great question to ask that you had brought up about, the sports bra and the workouts. Like, do you feel like you fill out your top, like you have enough breast tissue, you just want it tighter, then, that's what you're going to have, except you're not going to have that laxity of the skin that's there, which is in select patients, kind of like liposuction patients. In select patients, when they're a good fit for just lipo or just a breast lift, it can be a home run. Otherwise, especially within our our practices are communities where it's a lot of like after pregnancy, mommy makeovers, lost volume, weight loss, skinny shots, things like that. It's really hard to duplicate what an implant can do in the upper pole if that's what patients are most desiring to have improved.
Yeah, I think the exam is so important. I had a patient the other day who, had seen a different surgeon. They're like, "Oh, you need to have an implant." And this is kind of that. Sometimes no one really needs an implant. And I was kind of expecting a very deflated kind of exam, but she had actually very full, dense breasts, but just really low. I'm like, "You are a great candidate for just a lift." We use internal bra mesh to help kind of really try to secure that. I mean, it doesn't replicate implants at full fullness, but at her 3 months, she's very full. And it's maintaining really well because it's dense tissue. It's not if it's not deflated. So there are certain patients who can get really great just lift result and full results. And again, that it's not in 10, 15 years it might not still be up there, but it's she's very happy and that we got rid of a lot of that loose skin. So I tell most patients no one really truly needs the implant, but when it comes down to what their goals are. And discussing that, because a lot of patients just don't want the implants for the maintenance, but they just are tired of things being floppy and kind of loose. So you can just really just tighten it up, and they're thrilled that they don't need to kind of pull things into bra. Things aren't falling out because it's now tighter and perkier. I think that's just a big aesthetic shift, kind of the ballerina body breast that we've kind of referred to, which is great.
Yeah, I agree. If they have enough breast tissue and if it meets with their goals, a breast lift is certainly easier for us to do and to recover from. But for patients to shy away from an implant just because they've read something about it or don't understand the rigorous scrutiny that the FDA does, or it's just doesn't want something that's foreign, then I think it just requires a little bit more education just on how safe it is and common it is. And oftentimes when even if you're saying it doesn't need to be changed every 10 years or that sort of thing, they're like, "Oh, okay," they're like, "Yeah, let's do an implant then. I thought it was like X, Y, or Z." So it's really like, what's the reasons why they're afraid of that? But no, we should not be pushing our patients, nor do I do that to something that I feel like I want. It's more of what they want, to just meeting at the center and being able to achieve the goals. Because you also don't want a breast lift patient to be 6 months out and being like, "Where's that upper pole fullness?" Like that's.
Yeah, I mean, you never promise that with the lift. That's for sure. As we're showing and looking at galleries, showing them before and afters, I think is really essential to show you like this is what a lift's going to look like at 6 months. 3 weeks are swollen and perky. They love them. Everyone, you're going to lose that to a certain degree unless it's kind of there. I think that's where kind of final message is, talking to board certified plastic surgeons, looking at their portfolios, making sure it matches that they can achieve goals that you're looking for. If they show you one result, you got to kind of be a little nervous that they haven't done, a lot of them, or someone as complex as you might be.
Absolutely. A lot of content shared on this episode, super common. Hopefully it's very informational and educational for our listeners. And this is just a hot topic coming in for patients who want more natural, and it can be achieved with either breast lift or breast lift with implant, or just a breast implant, depending on your body, your goals, and your board certified plastic surgeon.
That's right. Great chat as well as always. So you have a good rest of your day, and we'll catch up soon.
You too. Take care.
See ya.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @SFullerSurgeryMD or @DanielButzMD. That's Butz with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.